Hi everyone, thanks so much for joining us tonight. I'm Amanda Marlow, licensed esthetician and head of consumer education here at Skincare Essentials. Tonight we have an exciting guest with us. We have Dr. K in the house. Thanks so much for joining us.
Thanks so much for having me.
I'm excited to have you here. We have so many questions for you.
Thank you.
Tell us a little bit about yourself.
Sure. So I'm a New Jersey native. I am a board certified dermatologist. I also have board certification in Family Med. I practice dermatology in my own practice in Lawrenceville, New Jersey. My company is Wellness Dermatology, and I see kids and adults.
Oh wow, you must be busy all of the time.
Very busy. Medical and cosmetic dermatology. Super busy.
Wow, super interesting.
Thank you. Yeah.
Well, thank you for finding the time to spend with us tonight and go over some ingredients. We have questions in regards to morning and evening, some of our new products, and we are going to have some questions from viewers at home. So I'm really excited for you to help me out with those.
Absolutely.
Can you tell us a little bit about some of the patients' concerns in recent time in regards to all of these ingredients? There's so many now on the market. It could be a lot. It could be kind of confusing when you're shopping. What is something that you look for in a morning routine just to start off your day?
That's a very good question. A lot of the patients I see have inflammatory skin disorders like acne and rosacea, and they just don't know what to use because of their sensitive skin. And usually some products can make their skin tingle or burn or not feel good, especially with pharmacotherapy that we have them on. So as far as a skin cleanser goes, my recommendation is something very bland and good for all skin types. I like the PCA Creamy Skin Cleanser.
Yeah, I feel like that one's just overall a great umbrella for all skin types, all different ages, and it definitely doesn't clash with many medications, is what I've noticed. I've dealt with all of the acne meds. And to mention PCA, I actually do love one of their toners. It's the Nutrient one. I feel like it's super balancing because toners could be really tricky. I feel like it's a step that's sometimes overlooked, but it also could clash with some other ingredients. So PCA all the way for cleanser and toner. I agree with you there.
Agreed.
Feel free to ask any questions in the chat below. We have our licensed estheticians here tonight. Any questions regarding ingredients, regimens for evening and night, evening and day, you could send them in the chat below. So after cleanser and toner, what would you say would come next in a morning routine? For me, I always think about morning being super nourishing and the steps that protect you for the day. What would you say a good serum is?
So I love the Clinical Skin, this one right here, the Pro Heal Serum Advanced. This is really good. This is very gentle for all skin types. I love it. I put it on directly in the morning. The vitamin C serum helps prevent against DNA oxidative damage, and it just is very protective, especially for the skin.
Okay, so that DNA damage, that would include the sun, that would include...
UV damage, absolutely, yes. And so it's very protective. I like it. And also, a lot of the patients that I see who are on medications that may purge them or cause them to have a little bit more acne before things get better, sometimes they need a little extra protection from UV damage so they don't hyperpigment.
And how about pollution? I heard that like vitamin C is really great for that.
Very good.
Especially for us girls that are in and out of the city all the time. We have to protect ourselves from pollution.
Exactly.
So that's the Pro Heal Advanced here. I've used this one for about 6 months. I saw results in my pores, in the brightening. I'm starting to see like early signs of aging around my eyes. It's even safe for that because it's really hard to find a vitamin C that's not so acidic. And I feel like that one's super gentle. It's like calming even.
Yes.
So that must be why it's good for rosacea patients.
I agree. Yeah.
That's great. And another bestseller on our site is the Clinical Skin. What's the difference between the two? Would you say one's a little bit more for mature type skin, anti-aging, versus those with acne-prone skin?
I agree. So actually the Clinical Skin Vitamin C Collagen serum is actually really good for anti-aging as well. It's applied the same as the other one in the morning. It provides the same DNA protection. However, it's a little thicker. And so I feel like it just provides a little bit more it's just a little heavier in that sense. I personally use it. I love it. I think it's a great product. I've noticed, like you were saying, reduction in pore size, brightening of my skin, decrease of my melasma, which is really great, especially as you get older, you develop that issue, and just overall improvement of my skin texture and tone. So I'm really happy with it.
That's wonderful. So it's like almost 2 serums in one, collagen and the vitamin C. After our serum, a moisturizer, of course, comes next to lock in everything that we've done. I like a lightweight moisturizer for a day. Is there anything that we should be looking out ingredient-wise when it comes to daytime moisturizers?
Very important moisturization. Your cream or your lotion should have ceramides, should have dimethicone, and should be a little bit acidic in terms of the way it's formulated. That helps to build a skin barrier and helps to improve the skin texture and tone. Yeah.
So ceramides, is that something that's already found in our skin naturally?
Yes. It helps our skin hold on to water and prevent transepidermal water loss.
Oh, very interesting. And then, of course, in my opinion, one of the most important steps of the morning routine, of course, SPF. What do you have in mind lately? What's a buzzworthy product?
So I find that the best SPFs out there, if possible, would be tinted SPFs. The iron in tinted SPFs really help to prevent additional UVB damage. And one of my favorite products is actually this one right here, the Elta MD UV Physical Broad Spectrum Lightly Tinted. I find that this is really good for sensitive skin, rosacea-prone skin, acne-prone skin, and I do highly recommend it. If a patient has any issues with the tint and the tint just doesn't look right, there's also the more chemical-based, less mineral-based tinted moisturizers and sunscreens as well.
That's so nice. So you mentioned UVA and UVB rays.
Ultraviolet A, ultraviolet B, yes.
Okay, so that's interesting. It's both. It's protection because of the tint. It helps even more.
The
so
tint
with the
helps
B.
even more so, yeah.
That's
Yeah.
awesome.
Which is more bang for your buck. If something can work better for you while you're on it, you might as well.
Definitely. And speaking of bang for your buck, it's almost like a concealer, if you will. Some people,
Yeah.
like to use it instead of foundation. I know for me in the
absolutely.
summertime, I love a tinted moisturizer, but this is almost that same consistency. It's super lightweight.
Yes.
I noticed this brand specifically, the Elta, it doesn't pill under my makeup. And I'm very oily, so it's almost everything pills, but this is the one brand that I really love for underneath makeup or in place of makeup for the
I
summer.
agree. Yeah, I love tinted. I use it in place of makeup all the time. In fact, when my patients are on a regimen where I tell them, the first, 6 months or so, you gotta, ease up on the makeup, but here you can use a tinted sunscreen. This will replace it, and that also covers blemishes, tones down rosacea, but also prevents more DNA damage from blocking UVB. So checks the boxes all around.
That's great. Yeah, and it is hard to cut down on makeup when you are dealing with rosacea and acne.
Exactly.
You have to because it's the only way to, resolve those issues. But on the other hand, you still are trying to conceal some of that. So this is kind of a great step in the morning.
Agreed.
Tonight until tomorrow, the next 24 hours, you could purchase it just to the side here. It's a wonderful deal, and like I said, especially in place of makeup, I think that's just an all-in-one sort of moisturizing, protection, and concealer in one.
Agreed. It's a large bottle too, so it'll last you a while.
Yeah. And then, in addition, just a quick question, doctor. I know that vitamin C is a protector from the sun and pollution. Is that something that we would only use during the day?
No, I mean, I think that there's definitely an indication if you want to use it at night, there's nothing wrong with doing that. Though there are different things that you can do at night that's a little more appropriate for the night. I would say maybe like retinols or something in that arena, only because those deactivate with UV light. You can't use them in the daytime. So you can get more of the efficacy for the vitamin A in the daytime and then the retinol at night. So if you can't use that, then there's nothing wrong with using both the vitamin C in the AM and PM.
Okay, great. And then, like I said, nighttime, there's so many ingredients. We get a lot of questions on social media. I'm sure you get it in your practice. Retinol is a tricky one. You don't want to go into the sun if you have a retinol in your practice, hence the SPF. But what is an ingredient that you would strongly suggest for nighttime? I know peptides have been like a really buzzy word as well. We have our polypeptide from Clinical Skin. That's a bestseller on our site.
Yeah.
Do you have any opinion on that one?
Yeah, so actually that's one of my favorite products. It has the copper and the zinc polypeptides, and it really helps with the vitamin C and the E that's in it. Plus, it's a ceramide-rich base. It just checks off all the boxes for being a great product to help both reduce fine lines, wrinkles. It's great for the neck in terms of preventing that crepiness of the neck.
I was just going to say the crepiness, even above the elbows, above the knees, the neck, it's like the earliest signs of aging.
Absolutely.
That crepiness, because of the polypeptides,
Yes.
it kind of creates that firmness and the loss of volume.
Exactly.
Before and
underneath
after is
the eyes
amazing.
underneath the eyes is great too.
Okay, so it's safe for the eye area? That's great. We do have some questions from our viewers at home. This one in regards to is clinical serum. Would you say it's safe for sensitive skin? Not the clinical skin here, this one specifically, the is clinical.
I would say it is safe for sensitive skin. It's been tested in clinical skin. It's been tested in sensitive skin people. And what I found that is basically it's able to not cause irritation in patients who have rosacea and inflammatory skin disorders. I find that it's very, very balancing, very neutral.
That's great. And then somebody had a great question. This is something I wanted to bring up. Again, clinical grade skincare is something that's coming up a lot. I've tried everything from drugstore to department store grade, clinical grade. Can you explain the difference, why that's something that we'd want to look out for?
Well, you really want to make sure that what you're putting on your skin has been tested. You want to make sure that it is in pure form and that it has undergone clinical trials. That's very important because this way you can know that it's gone through rigorous testing and it's been checked and it's safe. And so that's what differentiates a clinical grade from OTC brand.
Interesting. And I'm imagining those clinical trials are on all of the Fitzpatrick scale skin types, 1 through 6?
Yes, and that's super important because you want to know that you can use it and it's okay for your type of skin or combination skin or skin type or skin color.
That's great. Thank you. Okay, so this viewer here says, I have acne-prone skin. Would the vitamin C irritate it or break me out? I can answer this one because I've used it for the past 6 months and my skin has not, like I said, I've tried so many different drugstore brand, high-end department store brand, clinical grade now. Even within the clinical grade, some of them are a little too harsh. For me personally, I could look at something and it could break me out. This one has not. I love this one. It's super lightweight, all day. It doesn't make me all that oily. It's great for underneath makeup. So I would say that one is safe for acne-prone skin.
And since I use the Clinical Skin version of the vitamin C Pro Collagen, I can tell you, having acne-prone skin, that I don't break out with it. In fact, it really helps to just reduce my pore size, makes the hyperpigmentation go away, helps with the melasma. So no, it doesn't break me out at all.
That's great to know. So maybe I'll give that one a try next. Okay, we did go over this one here, the Elta MD, protection against UVA and UVB. This is something that I guess we are concerned about now. There's 2 different types of rays. I think you mentioned that this one, because of the tint especially, it helps protect against both. And this one's regarding all of our products. Do you have subscriptions? I'm glad you asked. Yes, we do. It makes everything so much easier. You'll never run out and have that lapse in your products. If you do sign up for a subscription, it's 15% off, no matter which product we have here. I think we could do it monthly, bi-monthly, as often as you'd like. You could also log into your account and change that if you're getting too many and you're not using them fast enough. You could always put the subscription on pause. You could change the frequency, but it does help with you not ever running out and having that lapse in product.
Definitely.
Okay, so this one, what is that bottle? The only one that we didn't talk about here. Oh, the Clinical Skin. This is, I believe this one's launching the end of June. It's a gentle cleanser. Actually, kind of what we talked about before. It is not foaming. It's a really nice creamy cleanser. This one's also clinical grade.
That's very good. It has, I see that one of the first top ingredients are 4 different types of ceramides, which help improve the skin barrier. So that's really good. That's definitely a plus for me.
So that polypeptide serum, I cannot wait to give that a try. It really sounds magical, and the before and after pictures say it all. I just think that everyone could benefit from it. Dr. K, thank you so much for answering all of those questions and joining us tonight. It's always a pleasure having you.
Thank you so much for having me.
Thanks, everyone. Until next time, have a good night.